Falls can be a severe health setback for elderly patients that can lead to long-term disability or significantly reduced quality of life. Contrary to popular belief, falls are often not the random occurrence we assume they are. The likelihood of falls increases with what we call fall risk factors, which can be assessed using a fall risk assessment. A fall risk assessment is a standardized screening tool for fall risk in your elderly patients. A fall risk assessment assesses different fall risk domains and assigns a fall risk status to the patient out of low, medium, or high risk. Although a relatively straightforward assessment, deciding on the next steps for the patient based on their fall risk requires clinical expertise. As such, fall risk assessments should be administered by trained healthcare practitioners, such as occupational therapists, physiotherapists, or geriatricians. The first risk factor this assessment includes is recent falls. Falling in the past is a good indicator that a patient may be at risk to fall again. This section assigns a score from 2 to 8, depending on how frequently your patient has fallen in the past. Another risk factor for falling is being on certain medications. The fall risk assessment includes examples of the sort of medications that should be counted for in this section. These include antidepressants, hypertensives, sedatives, diuretics, or hypnotics. Certain psychological factors can contribute to a patient's risk of falling, such as depression, poor insight or judgment, or anxiety. The patient's cognitive status is assessed using a separate assessment called the Hodgkinson Abbreviated Mental Test Score. This is a rapid questionnaire which is designed to determine the presence of dementia in elderly patients. In addition to these 4 risk factor categories, there are 2 questions which, if applicable to the patient, automatically give them a high fall risk status. Once you've completed each section of the assessment, assigning a score to each, it's time to tally up the scores and determine the final risk status. Additionally, if either of the automatic high risk status factors were selected, the fall risk status is high, regardless of the total score. We've brought all of these risk factors together into a fall risk assessment, which you can download for free as a PDF or find on our Carepatron platform. To find this full risk assessment from within Carepatron, just head to Templates from the menu on the left-hand side of your Carepatron app. Then ensure you're filtering by Community Templates to see Carepatron's full range of resources. You can then search our template library by keyword. If you found this video useful, be sure to like and subscribe to Carepatron's YouTube channel for more helpful content.